Abdominal pain in pregnancy. Today we will be discussing about why pain occurs in abdomen in pregnancy. Almost all the expecting mothers go through this condition once or later. They go through pain in the abdomen. So why this pain occurs and what is the variety of pain for which you should be concerned about? Abdominal pain may be just harmless, may be physiological, which may be normal, for which you should not be worried about, or it may be something for which you should really be worried about and tell your gynecologist. So today we will be discussing about what is normal and what is abnormal. First, we will be discussing about what are the pains which a pregnant female may go through and which are completely normal, for which you need not to worry. So it may occur in the initial months, it may occur in the later months, first trimester, second trimester, or the third trimester. So the pain which goes away after doing some kind of rest, after moving around, or after passing flatus, if the pain goes away, that means it is a normal pain and the pain is usually mild. So the pain which goes away by any of these things, that means that pain, you should not worry about that pain. That is a normal physiological pain which is occurring either because of some gastric disturbance or because of stretching or the growing pain which we call. Because of the growth of the uterus, because of the growth of the baby, the skin is also stretching, which may give you pain. This pain may be an acute starving like pain or it may be a dull aching pain. So this type of pain you may feel in the initial months or in the later months, for which you should need not to worry about. Now coming to the pains for which you should be aware of and you should definitely tell your gynecologist if you get this type of pain. So starting from the initial months, if in the first trimester you get a pain, abdominal pain, which is associated with bleeding or cramps, you should definitely inform your doctor, because it may be because of either abortion, you may be going through an abortive process, or it may be because of an ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is something in which the pregnancy is not inside the uterus, it is outside the uterus. I have explained about ectopic pregnancy in my other video. You can see that video for the details. So the pain which is associated with cramps and bleeding or spotting or brownish discharge in the initial months may be a symptom of threatened abortion, incomplete abortion, or an ectopic pregnancy. If the same pain, if the pain is severe and is not going away by doing rest, it is gradually increasing, it's not going away by changing the position, definitely again then you should tell your doctor. In the later months, this pain may be because of a preterm labor. It may be a preterm labor pain. That means you may prematurely landing up in labor. Sometimes it may be because of abruption placenta. That means the placenta, which is the lifeline of the baby, is separating from the uterus. That time also you may feel severe abdominal pain. In cases of high blood pressure, sometimes you may get an abdominal pain. If the pain is associated with passing urine, that means every time when you go through urination you feel an abdominal pain, then again you should tell your doctor, because it may be due to urinary tract infection for which you need treatment. Sometimes, which is quite a rare thing, you may get an abdominal pain because of some underlying fibroid or a big ovarian cyst. Ovarian cyst sometimes may get rupture or sometimes it may get torsion, so that may give you an abdominal pain. So if although these pains, this is because of fibroid and ovarian cysts, are quite rare, they are not that common, but as I just told you, if the pain is associated with bleeding, with cramps, it is severe, it is gradually increasing in the frequency and intensity, and if it is associated with urination, you should definitely inform your doctor, you should definitely tell your gynecologist. If you have any query, you can write us down in comment box section. Thank you.